Hi everyone, Dan Smith from Sports and Spinal Physio here. So today I'm going to talk about headaches and migraines. If you or someone you know is struggling with headache and migraines, then please listen on, because at the end of this video I'm going to tell you how you can take some steps to help manage and even resolve your headache or migraines. So here's the first problem, let me explain. If you've struggled with headaches or migraines for several years, then like many others out there, you will probably be fed up with taking medication all the time. You may have also noticed that after a while, some of these medications become less effective too, meaning that you need to find an alternative. Headache and migraines, they don't care if you have a dinner date or a family get together, they turn up whenever they want to. This means that you either have to cancel the arrangement at last minute, or you attend, but you end up leaving sooner than you would have liked to. Another problem you may encounter is that headache and migraines affect your working day. While you may go to work, the level of concentration and therefore the level of productivity you're able to achieve at work will be greatly reduced. If you can relate to any or all of these things I've said so far, please comment me in the text box and I'll come back to you personally with a reply. So, did you know that many headaches people experience originate from the upper three neck joints? Interestingly, you may not actually feel pain in your neck or even be aware of a neck problem. So the most common zones are up and over the side of your head, in your temples, across your forehead, and around the back just above the base of the skull. So you might be asking, how are migraines connected to all of this? Well, without going into too much technical detail, we think that a contributing factor in a migraine onset relates to an oversensitized part of the brainstem. Now, the brainstem is just below the main part of the brain, but above where your spinal cord starts. Among other things, it's possible for an unhappy neck to contribute to sensitizing this part of the brainstem, in turn leading to a migraine. I must stress though that there are other contributing factors that I don't have time today to discuss. So what does this tell us? It tells us that if you're struggling with headache and migraine, it's definitely worth seeing a clinician who is experienced in assessing for and treating this problem. In other words, a neck specialist. It's at this point that I'd like to say that all the staff at Sports and Spinal Physio are just this. We are trained to assess the upper neck for contribution in the production of headache and migraine. And if you'd personally like to chat to one of the staff, then please comment me below in the text so we can come back to you. Over the last 20 years, my team and I have worked on thousands of patients with headache and migraine, some with over 30-year histories. Many report trying all different types of medication without any long-term resolution. A significant proportion of the patients that my team and I have seen have made a full recovery from their headache or migraine and have gone on to lead a life without the need for medication. More importantly, a life where they are not forced to cancel important events and social arrangements. Our headache and migraine program isn't a quick fix and requires our patients to make small changes to their lives and to follow the advice that we give them. But in most cases, we are extremely effective at helping our patients manage their condition. If you are still listening, there's a good chance that you or someone you know has this problem. Now, to show our appreciation for your time, I'd like to offer you some useful resources on headache and migraine. Please click the link and claim your free headache and migraine information pack. Alternatively, you can leave a comment and we will personally and privately come back to you. Now, before I go, it's important to mention that if you have a brand new constant headache or your current headache is different to your normal headache, then you must consult with your GP or neurologist just to be safe. Additionally, if you're really poorly and have a fever with your headache, you should call the non-emergency NHS line on 111. I must stress that the majority of headaches are non-life threatening, so please don't be alarmed by my last statement. Now, I hope you have learned something new today, and please don't hesitate to reach out to us if you need any help or advice. My name's Dan Smith. Have a great day and thank you so much for listening.